COVID-19 changed everything. It changed the way we travel, the way we do our jobs, the way we shop. It made great big cities hit pause. It added a staple to everyday outfits. It left many people feeling lonely, anxious, trapped. We knew nothing would ever be quite the same as we watched the virus wreak havoc all across the world. While most of us were adapting to the new normal, a select group of essential workers was at the forefront of fighting the virus. It's hard to imagine what it was like to face COVID head-on as an emergency doctor in the ER. So we asked Agata Dow, an emergency physician from Ann Arbor, Michigan, to find out more.
My name is Agata Dow. I came to this country in 1992. In Poland, I finished Polish literature and language. I think I was very lucky. I always was drawn to emergency medicine, and since I went to medical school later in my life, I was a little afraid to go into emergency because it's a fast pace and people were talking about burning quickly doing it, and I was already 37 years old when I started medical school, so I wasn't the youngest one. I don't know what it was. There was some moment that I was like, why not? I've been struggling. I want to have skills. I want to belong to this country. This profession would be like perfect. Why not try? So that's why I applied to Wayne State Medical School, and that was the best decision in my life. I love my job. It's been more than 10 years now, and I feel great satisfaction and I feel joy every time I go to work. So working in emergency in a pre-COVID area was easy, I should say. It was just a regular days. People would come they were sick or sicker, and you will go and see them all. We had, because it's a fast-paced, we had our scribes, which were college students who would go with me from room to room and make notes, so I didn't need to spend so much time in front of the computer. I work in a community hospital, but we have a residency program, which I got involved in, and I love working with residents. So it was camaraderie, it was a very friendly environment, it was chaotic on the outside, but we all knew our roles, and things were done quickly. It was a very difficult time when we started to hear news that COVID was spreading in China and then in Europe. And we knew that we will expect at any time something happening in United States. The problem was that we were working with unknown. And the COVID presentation is like a regular flu presentation. So it's chills, it's headache, it's fevers, it's like a lot of different diseases. We, on top of it, we did not have instant testing. So when we had our first COVID test to check if patients are COVID positive or not, we usually would wait 7 to 10 days for the results, which made our work more difficult. The other part was that people were getting scared and anxious about COVID coming to this country. Therefore, the hospital administration did not want to create an atmosphere of panic. So in the beginning, we didn't even know if we should wear masks or not as a providers. In the beginning, what we were doing, we separated our emergency department, and based on the triage, we would send patients who were suspect COVID, we would put into one part of the emergency, and the other patients, which had belly pain or chest pain or headache, we would put them in a different part of the emergency. So I, as a physician, would go between two parts of the emergency and I would put a mask in the part where we suspected that they were COVID patients. We learned after that it wasn't true, that we had a lot of patients who were asymptomatic, that we had a lot of patients who had different presentations. So the fever not always was a presenting element of the COVID patients. The patients were scared. They were very anxious. I think we were too, but it is our job. So I think a lot of us didn't consider. We were like, okay, we are going into it. We don't know what we are getting into it. We are going to wear this mask. I think this division between having two parts of emergency department lasted maybe for 2 weeks maximum. Then we created like a tent outside of the hospital where people were triaged, so they would not expose the rest of the patient to the COVID. So we tried all different methods of triaging and selecting and separating the patient to try to figure it out. But by the end of the day, we realized that it really didn't work, mostly because patients are presented in very different ways. It was the next stage that we went into a full protection. So we had to put N95 mask, on top of it surgical mask, on top of it the shield, and then the gown and the gloves. So there was a full protection. It slowed us down because we had to gown and take the gown between patients. So we really were seeing patients march in a much slower pace. We didn't have as many patients then too because people were scared, so they didn't want to come to emergency hospital. But I could see among my colleagues that they were getting more anxious. We had our first peak in 2020. Governor did the lockdown. The first phase in 2020, people really took it seriously and stay at home, quarantine, were very cautious, and we didn't see many patients coming to the hospital. So the one who were coming were very sick, where they were mostly brought by ambulances. So our volume really dropped to less than 50% what we've been seeing previously. I think people get tired. I think a lot of people, also the one with chronic conditions, I thought they stayed at home for a very long time, but at some point they felt like they had to come. So we had the raise of patients' volume seen before even vaccination started. They started to come because they were sick. And I think young people started to come too because they, maybe this initial scare went off. I think generally people were just tired of staying home, so they started coming back to emergency. We definitely saw much of the fatigue, wearing the mask, wearing all the precautions. We could see more of my colleagues and my residents especially taking masks when they would be coming to computer just to take a little fresh air. We all looked very funny because we were wearing those masks for such a long time. Everybody got scratches on the tip of the nose, so everybody would wear a Band-Aid on the tip of the nose. What's happened also with the beginning of the vaccination, we all got vaccinated very quickly, so it gave us a little more of a confidence, and I could see that everybody was more happier and less afraid. We still are using N94, we still are using the surgical mask, we still are using the full protection when we see patients, but you can see people being more relaxed after the vaccine. I think that people became a little too comfortable getting even the first vaccine. and maybe are not cautious enough. But we do have several cases of people getting the first vaccine, coming to us and not feeling well, thinking that this is post-vaccine symptoms which they are having, and we test them and they come back positive for COVID. We really don't know as much about the virus, but those people who I encounter and my colleagues encounter, they were mostly people who got their first dose of vaccine, and 5-6 days later they are feeling very sick. We suspect that they were exposed to the virus around the time when they were getting vaccine. And people forget that the first dose of vaccine is not fully protective, that they have to get a second dose of vaccine, and then they have to wait for 2 more weeks before they are able to feel more comfortable, which still means wearing mask, washing hands, and keeping the distance. I remember as a child when I was going to the dentist, they would never wear gloves. It was the AIDS which brought that the dentist and physician started to use gloves while treating the patients. I think it will happen, something similar will happen after COVID. I'm hoping that we will not need to wear the N95 mask because they are very tiring, you barely can breathe, and I think that's what makes us as a provider super tired. But I think we will keep on wearing surgical mask from now on, and maybe eye protection also. We did not have any cases of flu, and I remember every year, even if I would try to protect myself, of course in the past years I didn't need to wear mask. I always wear glasses, so there was always some protection. I always wear gloves when I see the patient, but every year I would have a very light variant of flu despite getting a flu vaccination every year. This year I was not sick, nobody was sick, so I believe that we will keep on wearing masks. There would be another level of protection for us as providers. I think it was a good lesson for us as humans to realize how, despite how smart we are, how technology is developed, how much we can do in medicine, that the virus can come and we are helpless. The good part of the virus also, I think, was that it brought the world together and all the scientists were working together, sharing the ideas. When we think about it, how fast we developed the vaccines, that also shows you that in times of pandemic, the people really gathered together and there was a great solidarity among the people. But it shows us how small we are and how vulnerable we are in this world.